back. I missed the last live Q&A last week, so I was traveling. Hopefully everyone had a Merry Christmas and Happy New Year to everyone. And welcome back to another live Q&A. Looking forward to it. I love doing these, so hope you guys enjoy it. And please like and subscribe wherever you're watching it. If you're on Twitter, just retweet it. If you're on Rumble, like and subscribe and share it. And if you're watching at pro.longcovidreset.com, thank you very much for supporting us on our own streaming platform. We are working on it to make it easier to use, and appreciate everyone who supports us there. Most of our stuff that we stream out a preview, maybe 15, 20, 30 minutes of it, and then the rest of it shows up at pro.longcovidreset.com. So it's not www.longcovidreset.com. It's pro.longcovidreset.com. We'll see. I'm not sure if we'll switch over today or not. Maybe Christmas gift, New Year's gift. We'll just do the whole thing on this platform today. Make the whole thing public. All right. We have plans for this coming year. We're going to try to do more of what we've been doing, double down on interviews and stuff like that. And at some point, hopefully, I'll get into the news stuff more regularly. I tried to spin it up on Fridays, but got really busy at the end of the year. All right. So the first question is from Debbie. I've heard in some places people take ivermectin every week as a preventative and for overall health. Do you recommend doing that? If it matters, I drive a school bus and I'm around sick kids all the time. I also get bronchitis every year. So, COVID is a bioweapon. That's what it seems to be, right? People fall into a couple of different groups on what they believe at this point. Some people believe COVID doesn't exist. It was something else that was killing people in New York and other places. Some people believe COVID exists and it's a bioweapon, and they think the spike protein is toxic, and there's concern that people are getting it over and over again. They're getting repeated exposures. And 15 to 20% of the time when you get COVID, it goes systemic. It enters your bloodstream and you get systemic exposure to spike protein. The spike protein causes misfolding of proteins. It causes microclots. It seems to have some toxicity of its own, right? The presentation of long COVID is very similar to vaccine injury. And how do you explain that, right? Perhaps it's explained by the fact that it goes systemic and causes damage to the vascular system, which is the way that probably the vaccine injures people also, by entering the bloodstream and damaging blood vessels. So both of them will, if they go into the vascular system, they will destroy lining blood vessels and cause damage to underlying tissues as well as blood supply to those tissues, and they'll cause clotting. So I think both of them are dangerous, and so the infection itself can be dangerous, and it may be cumulative over time, with cumulative damage progressing and getting worse. And I mean, that's what seems to be the case. That I have a lot of patients. They're fine for a couple of years. They get 1, 2, 3, 4 COVID infections, and then suddenly the fifth one, or the fourth, or the fifth, or the third one, whichever, overwhelms their defenses, and suddenly they develop severe long COVID. So these can be super healthy people, super successful people, just from all walks of life, right? Young people, old people, middle-aged people. So it's, there is an argument to be made that we should try to avoid getting COVID as much as possible, or optimize your health to the point where it's very unlikely to go systemic, and it kind of, your surface immune system bounces it off. You kind of become bulletproof. You just expel it before it enters deeper into your body. So ivermectin every week, once or twice a week, works fantastic as a preventative, especially for people who are at high risk or who have a lower risk tolerance, right? So it's kind of like, I can't give general advice because there is no general advice. All medical advice, financial advice, all these realms that are so important and sensitive, there's just no way that I can give one prescription for the whole world, right? So for some people, it might not be necessary to take ivermectin every week, and then for other people, it would be very necessary. So the people, I think that it's really important for them to take ivermectin once or twice a week at this point in time are people who've had 1 or 2 or 3 shots, right? And then, it kind of depends on your risk tolerance. If you haven't had any shots, whether you think that you need it. There's some ways that you might be able to determine that, check if you have microclots. The only way to do that is with the microclot test. There's only one lab in the country still that does it. It's available at mygotodoc.com, mygotodoc.com. And then also if you think that you have long COVID, that would be another indicator that you don't want to get it again, because it can make it much worse if you catch it again. And if you've had long COVID before and it's resolved, it can bring it back. So that would be another maybe reason to be taking it as a preventative. You are around sick kids all the time. So that's another one, your exposure risk also would be another reason to consider taking it more frequently. Getting bronchitis once a year, I don't think that's necessarily a bad thing. I do tend towards the belief that these kind of illnesses in general, if it's, a normal run-of-the-mill illness, and that it's an opportunity for your body to detox. It's probably the same with COVID. The issue with COVID is that the immune system overreacts to it in the second week. So, one of the approaches is that you don't take preventative, you treat right away. And there's different ways of doing that. I recommend everyone keep a bottle of, I think it's Doctor's Best vitamin C 1,000 milligram capsules, and take between 30 to 50 of those capsules all at once when you start getting sick. And that'll wipe out COVID, it'll wipe out bronchitis, it'll wipe out any infection, really. It's incredibly effective. On the other hand, these infections are probably, like I said, an opportunity for your body to detox. So the only issue is that until we know more about COVID, it's like, do you really want to let yourself catch COVID in order to do the detox? There's other ways to detox. You don't have to get a virus or an upper respiratory infection to detox. And probably the vitamin C does probably give you an avenue of detox because it causes diarrhea while it's getting rid of your upper respiratory infection. It works for any infection, though, not just upper respiratory infections. So that's one way. The other way is, you suspect that you have COVID, you just treat that, right? You can do vitamin C oral, you can do ivermectin right away. You can also, the other way is if you become convinced that you got COVID at some point in the first week, in the second week, you can take steroids. So a short course of steroids starting on day 7 or 8 will essentially prevent long COVID from happening. So it prevents that immune overreaction. So having these things on hand is really important before you get sick, before you need them, which flies in the face of what human beings usually do. Usually we hope and, just hope that we won't have to deal with this problem. And then when the problem arises, we get really scared and try to, address it at the last minute. This is a recipe, a bad recipe. I'm not going to say it's a recipe for failure, because I do think that we can help anyone whenever they come. But if you want to really have the best chance of having no issues at all, get the medications beforehand at mygotodoc.com. There are a lot of other places you can get them, but I don't think anyone really gives you the right doses and enough of the ivermectin and hydroxychloroquine and everything else that you should have on hand in case you get sick. All right, so Cody says, does COVID make mold spread? I'm not sure what this means, what the question means. Maybe what you mean is if you have mold toxicity, does it get worse when you get COVID? That does seem to be the case, if that's what you mean. That's the only thing I can imagine that you might mean, because, you getting COVID or COVID being in the environment is not going to make mold spread into the walls of your house or anything like that, obviously. It can worsen anything else that's happening, right? So it can reactivate Lyme disease. It can uncover mold toxicity. So you may have a susceptibility to mold toxicity, but your immune system is able to deal with it, manage it, and keep it in check. And then when you have this extra added burden of COVID on top of it, then it becomes kind of uncovered and becomes a problem. EBV can become a problem. Lyme, co-infections of Lyme disease can become problems. A lot of things that were held in check. Not a lot, but a significant number of people have urinary tract kind of like maybe not low level infections, right? That usually don't give them symptoms. But when their immune system takes a hit, they might develop, might suddenly be going to the bathroom all the time, right? This can be men and women, right? I've seen it in both sexes. And some of these things are sexually transmitted, but not always, right? They're not always your typical STDs that you think of. They can just be, typical bugs that are found in vaginal secretions that are not what we typically think of as an STD. So those can be reactivated. Whatever you may be carrying can come to the fore, and it can cause problems when you get COVID due to the inflammation that creates an extra stress on the body. So, I've just been on this topic lately of light, the importance of light, which is why I try to sit outside. I'm going to try to improve the quality of the internet connection. I know the internet is a little bit spotty. My connection is a little bit spotty sitting here outside. I'm going to work on that. And hopefully in the next week or two, we'll have rock solid internet and good streaming quality for the video. But it's important to understand the complexity of full spectrum daylight, right? And how it works. So there are different wavelengths that are at different intensities in the morning, in the mid-morning, mid-afternoon, late afternoon, and towards sunset. So in the morning time, you have more of the, red end of the spectrum, less of the blue light. And then midday, you have a lot of UV and blue light, and they counteract each other. So the UVA, for example, will stimulate nitric oxide release, and the blue light will trigger production, upregulation of hormones, like stress hormones and stuff like that. And these two things counterbalance each other. When you spend all your day inside behind regular glass, so the glass that we all use throughout our society, it filters out the UV end of the spectrum. So you only get the blue light coming in. So we all have blue light toxicity, essentially, right? All of our screens emit blue light. The glass the sunlight that filters into our homes through glass is, selected for just the blue light. It removes the infrared, it removes the UV end of the spectrum, parts of the spectrum. So we develop like an overload of blue light, essentially. So you need to counteract that by spending more time outside, in full-on sunlight, full spectrum sunlight. And the other way that you can help to counterbalance it is by getting near infrared, red, and infrared lamp therapies into your life, and spending some time doing that. So that's pretty easy to do. It's you want to get it's not only the saunas, right? So there will be infrared saunas that heat you up, but there's also near infrared that you need, which is not heating. It just causes, it just helps to balance out the blue light toxicity. So hopefully as I learn more about that, I'll give you more tips and, pointers on the exact amount of time that you need to spend under the blue light. But, if you have it available to you, just go outside, right? Or open a window completely so that the actual sunlight comes through, it's not passing through glass. It's like you've completely opened the window so that the, sunlight itself is entering your home. And, this is not practical for most people, but you can also get quartz glass windows. So I can't find anyone. I Googled it, right? I couldn't find anyone. But, if you talk to somebody who makes windows, I'm sure they can figure it out. You can order this stuff, you have to go to a manufacturer and, it's a custom order of window glass that's made from quartz instead of what they usually make windows from. So quartz glass will allow, 90% of the full spectrum to come into your house or more. So you get the UV end of the spectrum and also the rest of it. And the other issue is the artificial lights at night, very harmful. And so, like I said, blue light causes a stress response, right? So you want to manage your stress. So that's one of the reasons we have to do a lot of extra stuff to help ourselves manage stress. And COVID is a stressor, other things are stressors. And so the reason I got on this subject was that if you do get sick, you need to find ways to decrease your levels of stress. One of those stressors is blue light from artificial lighting. So we just have a rule that, like, basically no lights after dark, right? Just don't turn on the lights. Get everything done before sunset, and then you'll go to sleep within an hour or two of sunset, just because you're bored, there's not much to do, and there's no light to do anything by. And then after a few days or weeks, you'll just very naturally fall asleep, at like 7, 8 p.m., depending on when the sun goes down in your area. And after the sun goes down, you can spend time on the porch or whatever, patio, and, it'll stay pretty bright for about an hour in most places. And then you just wind down, you get ready for bed. And if you do turn on the light, once you become sensitized to it, you can feel it's like an attack on your eyes and your body. It is a stressor, and you're supposed to get that blue light stressor during the daytime, right, to set your circadian rhythm so that you have hormone production in the morning and afternoon. All right, so I'm not sure if that connected properly, if I fully explained why I got off on that tangent, but hopefully it made sense. Denise says, is there a cough suppressant that is recommended? So there's two main kinds of cough that are important to distinguish. So one is like actually coming from your lungs, and your lungs are expelling stuff from them, right? And then the other kind, so that's a productive cough. The other kind is a dry cough, which is not productive. And in many or most of those situations where you have a dry cough, it's not actually your lungs that are triggering the cough. It's something up in the upper, like in the pharynx, right? Or the larynx. That can be due to a postnasal drip. Sometimes the antihistamine can dry that up. It can be due to reflux. Reflux can irritate, your upper airway and trigger the cough. So different things. And you can also have a post-infectious cough. And so in those cases, it's a cough drop can be oftentimes very helpful. Just keeping something that has like a pepperminty, nature to it, trickling into your throat over time will help to prevent that little tickle in the throat that makes you cough over and over again. So cough drops, different things like that. Fisherman's Friend is a cough drop that works pretty well, has menthol and stuff like that in it. And, in the olden times, and even nowadays, I use this. There's licorice root or bark, or like twigs. I think it's licorice root or maybe the twigs of the licorice tree. So you can buy them, on Amazon or wherever. You can buy, whole pieces of licorice, like branches or twigs or whatever, and you chop off like a little bit of it. It's pretty thin, maybe a centimeter or less, half a centimeter diameter, and you just kind of like start chewing it a little bit. It has a slightly sweet flavor of licorice, and chew it up a little bit, soften it up, and just kind of like stick it like the way they stick a wad of tobacco, in the South or wherever they do it, here inside your gum. And you can actually sleep like that. And what it'll do is stimulate saliva, and the licorice will go down and have this soothing effect on the throat while you're sleeping and during the day as well. That's a great cough suppressant. Tessalon pearls, we oftentimes prescribe that. They don't work very well. Probably the best cough suppressants are opiate cough suppressants, but they're hard to get, So if you can get your hands on one of those, that's not something I can prescribe online because, they're controlled substances now. So, but if you can get your hands on an opioid cough suppressant, that works better than anything, and it should really be more readily available for people. But if you are bringing up stuff, I would hesitate to recommend a cough suppressant because you want to get it out of your lungs. Lisa says, does the spike protein go away after a certain time, say a year ago was the last vaccine? I'm curious if you have intercourse with a vaccinated person, can they contaminate you with the spike protein? It seems yes. The answer is yes. So in the worst cases, people have had to either treat their significant other in order to get better themselves, or separate, stay apart for a while they're healing from long COVID or vaccine injury. So the spike protein should be removed from the body after a certain amount of time, but it varies in everyone. And I think that, one of the markers that you can track are the microclots. Are those clearing up? And the other marker that you can track is the Incel DX test, the cytokine panel, which will give you kind of a fingerprint of spike the inflammation that your body produces when you have spike protein around. And a final indicator that you can kind of go by is the spike antibody level. You should see that dropping, ideally less than 500 on the LabCorp version of the test, to indicate that your immune system's not constantly being stimulated by spike presence. Do the bad ingredients stay in the body unless they clean the blood with either chlorine dioxide or Dr. McCullough's protocol? So I still haven't, done a deep dive on chlorine dioxide, but yeah, Dr. McCullough's protocol, his base spike detox protocol is nattokinase, bromelain, and curcumin. I think that's a great start, but I do recommend other things. So I recommend taking the nattokinase with serapeptase. The bromelain is great. Curcumin is great, but I also recommend Nigella sativa, and you can add a few other things. So dandelion is really helpful, and so check out my go-to stack. Get the herbal product, has curcumin, dandelion, Nigella sativa in it. And that's the immunity herbals. The immunity vitamins has bromelain in it. The detox spike buster has the nattokinase in it. Augmented NEC I highly recommend too. So ways to detox, those are all great places to start. In order to get rid of the microclots, the nattokinase, serapeptase, bromelain, augmented NAC or regular NAC are very helpful. Aspirin, 81 milligrams a day is helpful. Donating plasma is very, very effective at this, right? It physically removes the microclots. So that is also highly recommended in general, especially if the microclots aren't going down. And then, doing that for 3 to 6 months, usually the microclots will go down, even without adding things like Plavix or Eliquis. So not everyone needs to add Plavix and Eliquis, but if they're not going away, then you would want to add stronger anticoagulation. Is it absolutely necessary? I mean, for some people, I think it is necessary. Some people are not clearing it out, and other people are. The other part of detox would be, in our Spike Buster supplement, we've also added fulvic and humic acid, which will help to remove graphene oxide and heavy metals. So that's also really important. And then there's a number of other, detox supplements like chlorella and stuff like that that can be very helpful as part of a detox protocol, because you need to detox from more than just spike protein. You need to detox from heavy metals, you need to detox from plastics, microplastics, PCBs, all these, forever chemicals that are found in your body. Plasma donation will remove all of them, right? And then things like chlorella will also help to remove them. It should be taken, maybe at night, a couple of hours away from a meal. And while you're doing this detox, you also need to be really focusing on nutrition, very, very nutrient-dense diet. All right, so I think that's a good 20 minutes or so. We're going to go ahead and switch over to I said we were going to do a freebie today, so we're not going to switch over. So usually we would switch over to pro.longcovidreset.com, but today we'll just keep going on all of our public-facing channels. And next time, highly recommend you sign up at pro.longcovidreset.com because we release a lot of the full interviews and everything on there. And usually the Q&As will be cut short around 15 to 20 minutes, and we'll complete them over there. But today I'll finish it out over here. All right, so Lily Vo says, my question is, from overuse of magnesium oxide supplements to create peristalsis, now there is a lazy colon, and without the supplement, the peristalsis is so slow. What should I do? Yeah, so when you use a crutch or you use something like this to stimulate things, it's going to take time, and you might want to taper off of them instead of suddenly stopping them. But it's really, and I think she also said body mind is included. Anything else? So yeah, if you're doing mind body medicine, that's great. You might need to take something else to help to control. It sounds like constipation. So you can look into Triphala. That's extremely effective for bowel issues in general. But you might want to consult with an herbalist who can come up with a formula that's specific to your exact situation. You can also consult with homeopaths. I don't know a whole lot about homeopathy, but I do think there's something beyond just placebo, and I've seen it work in person. I've seen really remarkable changes with them. But even if it were just placebo, why not? If placebo works, that's great, right? So check into a number of different modalities, and you'll find something that works. Look into herbology, acupuncture, homeopathy. So Triphala, Triphala, is kind of a panacea from Ayurvedic medicine for problems, issues in the gut, and it works tremendously well for all kinds of really severe problems, both constipation and diarrhea. So that's one thing that you can try. You probably do need some magnesium, right? Most of us are very deficient in magnesium. So not necessarily the magnesium oxide, which is really stimulatory, but something like magnesium glycinate, which is better absorbed. So it's not going to trigger the diarrhea, but it will keep the magnesium levels up in your body. And just make sure you're optimizing nutrition as well. And another thing that you might look into would be a castor oil pack. You can buy these wraps on Amazon, and then you put castor oil in it and you strap it around on your liver. And also you can try it on your belly. It helps a lot with constipation. So that's quite helpful actually. So consider doing that. Spend time in the sun. The sun is really necessary for activating a lot of the food that you eat, and the hormones that your body makes, and for powering your mitochondria. So everything just works better when you get regular exposure to sunlight throughout the day. So you want to try to get some exposure, like 30 minutes at sunrise, as much of your skin as possible, but it'll go through the sun. The infrared will go through your clothing. So just wear like one layer of clothing if you must, but if you can, remove it. But still, like one layer of clothing will only block like 10% of the infrared, something like that. So the time that you want direct sunlight would be midday when you're looking for UVB, and which makes vitamin D in your skin. And then midday for 10 to 20 to 30 minutes, depending. If you're very, very light skinned and you burn easily, then do less time. Over time, you should tan, especially if you're getting the morning sun as well. And the morning sun doesn't tan you; it's the mid-afternoon sun. And also late, as the sun's going down, you want to go outside, and that's possible for most people. Most people can get up, can shift their schedule so that they sleep really early. Wake up around before sunrise or around sunrise, get that really early morning sun before work, and then during their lunch break go outside, have lunch, and then after work, kind of winding down, you take a walk at around sunset for 30 minutes before sunset and just get some more sun. So all of these different times help to sync your body's circadian rhythms and also activate various hormones and nutrients that you need. So it's really important. It's as important as it is for plants, for human beings to get sun. Those are some things, and also walking more, exercising more can help to stimulate the colon. Constipation can be really a tough thing. So it does oftentimes require a consult with somebody who's really good at figuring out what is going on. So if those things don't work, you should really consult somebody in person. But yeah, mind-body medicine can be a big part of constipation. Positioning, maybe get two stools next to your toilet so that you're squatting when you go to the bathroom, or buy squatty potty, it's called. that can make a difference for some people, but not for everyone. And not delaying, right? Like when you feel like going to the bathroom, go. Don't hold it. Don't do that. And eating at the same time every day can also be really important. Eat, ideally very early in the morning. So after your 30 minutes of sun, have breakfast, and get used to having breakfast very early, which is optimal for humans. And then, exercise. Try to, if you can, exercise sometime mid-morning. Obviously, that's not always possible if you're working, or early afternoon. You can exercise as well, and then stop eating 4, 5, 6 hours even before bed, and aim for like 2 meals a day. I don't think people really need to eat 3 meals a day. So an early breakfast, maybe a late lunch, and then you're done. And that'll help to optimize your digestive system. But still, constipation, I know, can be really serious, and sometimes it can be really difficult, and you need something specific to you, right? Not just a generic treatment. Jennifer says, my vagus nerve is so dysregulated, or my autonomic nervous system is so dysregulated, I'm losing bodily function. Looks like a stroke every other day now. Talking and stress seem to be triggers. I'm always sitting with the legs up, so not blood pressure related. Why is this happening? Why am I not getting better or even getting back to my baseline? My baseline gets lower and lower. I have a short video if you need to see what happens. Resting with no talking is the only thing that helps until the next unknown trigger sets me off. Yeah, so the issue here is what is causing, and the answer is the same for any illness, honestly. It's just the details are different, right? So the broad strokes are going to be the same. The broad strokes will help you to find the specific details for yourself. So the broad strokes are that there are some toxins, there's something, right? Those toxins are multiple, right? Stress is a toxin, spike protein, microclots, heavy metals, all of those, environmental toxins that are in your body, they are harming your body, right? And they're causing your symptoms. And then on the other side, and those include negative thoughts and emotions, and all of these things that are triggers for you, are your body's able to deal with what's going on until something overwhelms its capacity to deal with it, and that overwhelming thing is some unknown trigger or a known trigger like stress, right? So light, at the wrong time, and even during the day, if you're inside, you are getting toxic exposure to blue light, right? So it's up to you what you can do, but spend as much time as possible outside. If a certain time of day is a trigger, then avoid that time of day, or just do it in very, very small quantities. But usually almost everyone should be able to tolerate early morning, late afternoon. Some people may have some photosensitivity in the mid-afternoon with the UVB. And if none of that's possible, get an infrared and, lamp, or, near infrared and infrared lamps, and just get that every day for like 20 minutes a day, on the front of your body and on the back of your body with your clothes off, ideally, or just one layer of clothing. And obviously toxins from food, too much, too many carbs, toxins from being overweight, so a lot of these are all on the toxic side of the equation. And then on the other side, you have nutrients and building blocks that your body needs to recover and get better. Those range from, positive thoughts, positive beliefs, gratitude practices, these are all healing. Light at the right time, right? Sunlight at the right time of day, infrared, near infrared light, proper food, clean water, sometimes supplements and herbs that are helpful for you to detox, and all of the, vitamins and minerals. And sometimes people are specifically low in one or the other of the, very important vitamins and minerals that their body needs to recover. And common ones that people become relatively deficient or severely deficient in would be the fat-soluble vitamins A, D, E, and K, especially K2, copper, zinc, the B complex vitamins, all of them, or certain ones of them, people can become very deficient in, and magnesium is a big one. Potassium is a big one. So potassium citrate. So I recommend people supplement all of these, and then, there's advanced nutritional testing that we can do to try to narrow down what exactly is missing. And then even beyond that, for the very rare cases that just aren't getting better no matter what you do, you need to look into comprehensive genetic testing and, look for the 1 to 5 genetic abnormalities that everyone probably is carrying around, but that are unique to you. So that's the main thing. An evolutionary lens can help you to get better, right? Thinking from an evolutionary perspective. And I don't mean, a lot of people don't believe in evolution. That's fine. I don't mind if you believe in evolution or if you believe in intelligent design, but 99% of people are going to believe in one or the other. And at the end of the day, this makes sense to both of those groups of people. So if either way, the point is that we are optimized for a certain environment, right? So when we're in that optimal environment, we have the best chances of being healthy, right? So what is that environment? That environment is nature. Okay, it's outdoors. It's not inside. It's not inside a cave. All right, and it's certainly not inside a cave that has gives you the false impression that you're outside because light is streaming in through the windows. It's filtered light, right? It's not the the important invisible parts of the spectrum that we need are filtered out by the glass. And then, artificial lights inside are just toxic, especially if you have moved on from, the incandescents to the CFLs and fluorescents and stuff, and other ones. So basically, imagine what your life would be like if you lived 1 million years ago, okay, and you didn't have any of this civilization, and try to make your life as close to that as possible, which means you spend ideally most of your time outside, or at least you go outside multiple times a day frequently. You're grounding, so you're grounding throughout the day. You have a grounding mat wherever you sit or lie down, and you're eating clean food, trying to avoid toxins. You make sure your water's clean. Try to minimize time spent online and on social media and stuff like that, which is a real stressor for a lot of people. It goes on and on. So if you optimize your lifestyle and your environment, get rid of lights after dark, shift your circadian rhythm so you're waking up early, going to bed early, having community, social interaction, all these things are very healing. And some of them might not move the needle much on their own, but you combine them all together into a full-on lifestyle protocol, and it makes a tremendous difference. And within month, 2 to 3 months, you'll find a huge shift in the way that you feel. First of all, the shift will happen in how you feel about your illness. So you'll feel better in general, even before your symptoms go away. And then your symptoms oftentimes will start to go away. And there's a lot of, tricks and tips and hacks and stuff like cold exposure and different things, breath work and meditation practices, or just stretching. If you're not into quote unquote meditation or yoga, just stretching, right, can be really helpful with people, and just, mild exercise to moderate exercise. So there's a lot of stuff that goes into it, but you can definitely get better, and the things you need to focus on are removing the harmful things and giving yourself all the beneficial things, because your body at the end of the day will heal if you remove what's actively harming you and give yourself what you need for the building blocks, to get better. That's the long and short of medicine. It's not about finding a cure for you. It's about removing what's hurting you, right? And giving yourself what you needed anyway, right? To rebuild, and figuring out what those things are that need to be removed and how to remove them and what you need to give specifically. That's where the skill, I guess, comes into it. But you can hack this yourself, or you can hack it with somebody else. And I think everyone should really probably be in a group coaching program of some kind. So we have the Phoenix Protocol and Lean Vitality I would highly recommend, if you're chronically ill, whether or not you have long COVID or not, or vaccine injury, just any chronic illness, it doesn't matter, or you just want to get healthy, join the Phoenix Protocol. We right now we've been on hold for a month or so, waiting until enough people sign up to start a new cohort. So once we get one or two more signups, we'll be able to launch a new cohort, and they go for a couple of months. Most people actually who join for the 2 month cohort or course repeat the course a few times, just because repetition really helps, and just it's beyond just like what you're learning about. You gain strength from being in a group, and you want to tell them that you did something in the last week. So there's that benefit of having other people keep you accountable, and then a coach obviously is involved who can help answer questions. So this is really the easiest route to permanent long-term lifestyle improvement and change. The easiest route to that is group coaching. It's the easiest way to change, and people throughout different industries know this now. There's mastermind groups in business and stuff like that, and it's much more effective than one-on-one coaching even. So I highly recommend, even if you do have the resources to do one-on-one coaching, or even if you want to, also join a group coaching program. It's tremendously beneficial for everyone. And you don't have, you can change at your own pace, and I actually recommend people not to make drastic changes all of a sudden. Just do it really, really slowly, and then it becomes very natural, and there's no resistance to change when you do it that way. All right, Paula says, my primary issue is fluoroquinolone poisoning. COVID seems to have exacerbated these issues. I'm not vaxxed. I refuse all medical treatments that I don't understand. Medical practitioners must prove that they're not part of the medical industrial complex before I'll listen to them. Yeah, this is a big problem. Online, you can find a lot of communities who are talking about being floxed, FLOXXED, by fluoroquinolones. So, there should be a focus on detox. And I do believe that some of these toxins get stored in different parts of our bodies, and they're not distributed throughout the entire body. They may be focused in certain places. And really skilled, Chinese medicine practitioners, acupuncturists who, acupuncture, the way it's done in most places, most clinics nowadays, is just like tiny little needles, in the surface. But there's other forms of acupuncture which are almost like non-invasive surgery, right? So they use much bigger needles sometimes, and they can get in and separate tissue planes that have gotten stuck together, and they can release chemicals that have gotten stuck in your body. So look around, try different ones. It's going to be hit or miss. You're just going to have to visit a bunch of different ones and see if one of them can help you. Mind-body medicine can help a lot also. Homeopathic medicine can also help release this stuff. So it's a matter of detoxing from the fluoroquinolone, and I wonder if some people actually still have a reservoir of some of that, fluoroquinolone in their body, actively harming them, and that they need to get out. And the other part is just injury, right? Like the fluoroquinolone actually injured certain tissues. It injured mitochondria, it injured parts of your tissues, and for one reason or another, because of ongoing inflammation from other causes and lack of nutrients, you're not able to heal those tissues. So how do you heal those tissues? Again, it's a matter of detoxing, removing all the other toxins that are in your system. You can do that with things like chlorella and plasma donation, et cetera. Fulvic and humic acid for the heavy metals, et cetera. Making sure you have very, very strong nutrition. And I think a lot of people can benefit from doing I didn't mention this before, but it's very helpful to be on a restrictive dietary regimen, either an AIP diet, autoimmune paleo protocol, or even as strict as like a carnivore diet. And you may need to choose a certain particular animal. If you are not feeling good with beef, then switch over to something like lamb, or try fish, or try, et cetera, right? So find a, meat, seafood heavy diet that is just avoids all the things like grains and, all the, there's a lot of vegetables that have some toxicity when your gut's not working properly, and people need to heal their gut. So it can take 6 to 12 months to do that. And the easiest, fastest way is oftentimes carnivore. You're eating meat and you're focusing on also getting organ meats, like a meal of organ meats once a week. So all the different organs that you can get once a week, a meal of that, or just spread it out throughout the week every day with organ supplements. Meat every day, organs at least once a week for a whole meal, and broth every day, and make a proper bone broth, and get a lot of collagen and all of that stuff. So really eating nose to tail, eating everything that's in there, so that you get all the nutrition that you need from the animal. You can supplement things like oysters and stuff like that, for copper and zinc and a lot of other stuff as well. So heavy on stuff like that. And avoiding basically everything else, right? So no grains, soy, sugar, nightshades, vegetables that are heavy in oxalates, all that stuff. You just remove all that stuff, anything that you might react to. No eggs, no nuts, no seeds. All of these things are commonly reactogenic. They're triggering problems due to gut dysfunction and not being fully digested before they're absorbed. And then maybe supplementing some things like selenium and magnesium and zinc and boron, just to make sure you're getting enough of them. And then giving it time, right? So and just like the whole lifestyle thing, right? The whole package, getting the sun and the light and avoiding the light at night and sleeping properly, and making sure all the different parts of your lifestyle are dialed in. It is possible to heal, for sure. And light is really important for mitochondrial healing. Infrared is really important for that. Some people will find benefit with things like methylene blue and other things that'll help to boost their mitochondrial function, and some people will not. So it's something to be careful with. So yeah, that's what I can say about fluoroquinolone poisoning. Jill Padawer says, I'm curious about your thoughts regarding a vaccine injury that seemingly was time limited. Do you think there might be remaining risk almost 3 years after the incidents and suggestions for prevention? There's no way of being sure unless there's some sort of test that you can do. So, some people, if you put enough stress on your body, if you run hard enough, if you, exercise hard enough, you'll find that there's a certain point where you develop symptoms, right? You're able to put up with, like, maybe there's something hidden, right? So that is possible. So it's just that you might not be pushing yourself hard enough for it to be uncovered. So you need to, if you want to be sure, then, it depends on, you need to do things like testing. You need to push your body physically to see whether it uncovers some issues, stuff like that. Check for microclots, check for the immune fingerprint and the Incel DX test, check for spike, the antibody spike, and other things. You can check, you do screening tests for cancer, you can do screening tests for your immune system, you can look for vaccine-acquired immunodeficiency. So all these things can be there and not be apparent, right? So it's just something to be aware of, that it might be unlikely, but I can't tell you that it's all fine just because you had a limited reaction and you've been fine for 3 years since. There could be something developing, right? That's the whole point of screening tests, is to try to catch something early before it becomes a full-blown problem. Pfizer vax number 1, female got almost 3 years ago, 2.75 years ago. Within 1 hour, developed skin blotches on the hands. Took the Horowitz recommended supplements, not at full dose, to prevent vaccine injury. Within 3 hours, there were more prominent blotches. 18 hours after the vaccine, woke with Parkinsonian-like very rapid unilateral hand tremor. Could not control the movement. It subsided 45 minutes later while lying on the couch, legs outstretched. One leg began to involuntarily shake uncontrollably, stopped in approximately 10 minutes. Never had similar symptoms before that or afterwards. I did not get shot number 2, nor boosters. Any thoughts on what might have caused the symptoms? Any risk? Any ongoing risk, any prevention to take now? So I think I already answered it. one of the theories for sudden, especially those sudden vaccine injuries, is the bolus theory from Mark Girardeau. You can find it at covidmythbuster.substack.com. So COVID Mythbuster is all one word, no spaces, .substack.com. Take a look at that. He explains it clearly that somewhere between 3 to 5% of intramuscular injections will enter the bloodstream in some quantity or other. And once it enters the bloodstream, it's gonna, if a concentrated bolus of that injection can go and like hit certain areas of, it can go anywhere, right? It can go into your heart, it can go into your brain, it can go into your organs, and destroy areas of the vasculature, the vascular system, the lining of the vascular system, cause clotting, cause damage to the organs, cause damage to the gut lining, cause damage to the basement membranes that are between the vascular wall and the organs. So that's, to my mind, is probably the reason that people get these immediate reactions or very, very quickly after getting the vaccine. So you got direct damage to organs, right, and the vascular system, and it healed, right? Or obviously it healed, right? You got better. But is there some mild damage left that never healed, that you just, your health reserves are enough that, health is basically a balance, right, between opposing forces. So there's things that are tending towards making you sick, and there's other things, your organ reserve and your, life force, essentially, right? Like if you want to like give it a term that like wraps up a lot of different things together, right? Your chi or whatever, right? So this just means like, okay, there's like a million different things and we're just giving it one name, right? All the different things that contribute to you being healthy, whether it's like sunlight and the food that you eat and your genetics and your gut bacteria and all that stuff, all together is your kind of like your life force, right? And that's tending to make you healthy. And if this is strong enough, it can overcome a lot of negativity and a lot of negative things dragging you down. If this gets weaker, eventually these things may tip the balance over into ill health. So you could have damage that's just not apparent because of a strong life force in general. And as you get older and this gets a little bit weaker, the damage may come to the fore and you may have problems. So one of the things I haven't covered today is like, Mark Girardeau's, recommendation for what do you do for that? How do you heal? So I interviewed him. You can find it in my Twitter stream, probably on Rumble and at pro.longcovidreset.com. And he had a really great suggestion of 100% oxygen therapy, essentially. And the reason is that high levels of oxygen cause oxidative stress, essentially, which in some situations we consider to be, negative, right? It's something we take antioxidants for. But it also triggers stem cells, right? So those stem cells reproduce and they enter your bloodstream and they go everywhere. And the same thing happens actually when women are pregnant, or a similar thing happens, that the baby inside the woman, cells from that baby, stem cells from that baby will enter the mother's circulation and they'll help her in different ways. They'll go in, oftentimes the pregnancy itself, a lot of chronic illnesses will disappear sometimes during the pregnancy. Is quite remarkable. And those stem cells, integrate with the mother's tissues in different places and they remain with her for life. But you can trigger your own stem cells and you can do kind of a home stem cell therapy on yourself very gradually. It's not something that, gives you tremendous results right away, but 100% oxygen will trigger those stem cells. They'll enter your bloodstream. They'll find places that there's damage and they'll fix the damage. They'll fix the vascular, blood vessel walls that were damaged. They'll fix the basement membranes that were damaged. They'll fix the organs where they were damaged. They'll fix the gut where it's damaged. So the recommendation was, you could probably speed this up by doing hyperbaric oxygen therapy at the higher pressures, like 3 atmospheres a day. People with even severe problems like Parkinson's will usually find benefit within 40 hours of therapy. So 1 hour a day for 40 days, for example. At 1 atmosphere, which is room pressure, right? Like, just at sea level, right? Without a hyperbaric chamber, 100% oxygen, you're getting about 1/3 of the effect, right? So you can multiply the 40 by 3, 120 days, or you could cut it in half to 60 days if you do an hour twice a day. Might be something that could work. So I do now prescribe oxygen concentrators for people. I used to hesitate to do this. Any therapy can have downside risks, right? There can be oxygen toxicity if you overdo the oxygen. So you don't want to do a lot. 1.5 to 1 to 1.5 hours, 1 to 2 times a day, should be the max, and do it for plan to do it for a few months and see if you feel better. So, but in your case, there's no evidence that there's any problem to begin with. So, if you're concerned and you want to be sure before you go down that route, then, the 3 tests I can think of that would be really helpful would be microclot, number 1, the in-cell DX test, number 2, the spike antibody level, number 3, and then depending on resources, you could do like a Gallery test for cancer, which screens, just a blood draw will screen for over 50 different common cancers. And it's like a genetic marker that's released by those cancers at very, very early stages. And the lymphocyte subset panel, or a more advanced version of that from Cyrix Labs, which is called the lymphocyte map, will help to determine if there's any problems with your immune system. It's not working properly. So those are probably the primary screening tests that you can look into and that you can get from mygotodoc.com. Pauline says, in your opinion, what's the cause of brain fog? What's the best way to get rid of it? So it may be, different causes in different people. And, these things like Parkinson's or brain fog or diabetes, even, they are clinical syndromes, and the causes can be multiple, right? Many, many, many causes, and oftentimes combinations of multiple things. So brain fog in a lot of people can be due to vascular inflammation. It can be due to inflammation in your body that is affecting your brain. It can be due to, and it's probably all of these things at once, right? Autoimmune issues, brain neurological inflammation, kind of like the software of interpreting the signals from outside your body has gotten kind of disrupted, and that can lead to tinnitus as well as brain fog, autonomic dysfunction, hormones out of whack, the microbiome out of whack, all of these things to a lesser or greater extent. Histamine, too much histamine is a very common cause of brain fog. So all of these things are probably contributing a little bit or more in one or another, one person or another, to different extents, and that's why we try to hit all of these bases when we're treating. Mitochondrial dysfunction for a number of different reasons, due to spike toxicity, microclotting, all these different things are likely contributing to the brain fog. Imbalance of glutamate and GABA, cortisol levels, out of whack. They're low in the morning, they're too high at night, all this stuff. So the best way to get rid of it. So nicotine oftentimes helps. I mean, nicotine itself is a stimulant. It binds to the nicotinic acetylcholine receptors. If you try nicotine and it's hard to come down and to go to sleep at night, then you can take Mulungu root powder. That'll help to bind to those receptors and kick the nicotine off when you want it to come off. So Mulungu bark powder, Mulungu, and I got it from, I can't remember. I posted it on Twitter. I just posted something on Twitter. It helps a lot with sleep. It's an incredibly effective sedative, hypnotic kind of, sleep triggering herb, or sleep supporting herb, and something Mundi, I think. Let me see. I'm just going to search for it real quick. Anima Mundi, I think it was. Mundi. I think if you look for that one worked well. animamundiherbals.com. So What else is the best way to get rid of it? If it is neurological inflammation, then melatonin, high doses of melatonin are really effective. Intranasal insulin, like 10 units of fast-acting insulin, not regular insulin, can be really effective as a um, anti-inflammatory for the brain. But yeah, I mean, the place to start would be high dose melatonin. So we're talking about 30, 40, 50 milligrams of melatonin. And at those doses, it doesn't cause so much of sedation, or it doesn't help so much of sleep. It just helps with the brain inflammation. And then detoxing spike, just detoxing in general. Heavy metal toxicity can be a big part of brain fog. I don't like to just say, okay, just do this one thing, because that's very hit or miss. You got to start with that maybe one thing and then try all the other things. And the more comprehensive you are in your approach, the better it'll be. All right, so we're going to try to wrap up quick soon. Paul O'Malley says, I have elevated intraocular pressure. My first eye visit post-COVID revealed elevated intraocular pressure last year, and last week's follow-up was still high but slightly decreased, still in the low 20s. If there's a correlation with long haul and what I could do pre-glaucoma, it does not run in the family. Thanks, Paul. Yeah, light exposure is really important for eye health, so get outside early morning, watch the sunrise, and avoid the blue light during the day. And eye exercises, so you look up Chinese eye exercises, there's pressure points around the eyes, and then there's these eye movements. And I know somebody who essentially cured you can cure glaucoma with things like that. So eye exercises, optimizing nutrition, getting rid of toxins. But yeah, it can be due to long COVID. Essentially long COVID speeds up whatever else is going on. But yeah, the light toxicity and absence of healing, like infrared light. So you can also use infrared light on your eyes, and it's helpful. I mean, people have recovered their vision. They've gotten rid of glaucoma. So this stuff is a lot more effective than you would imagine. So infrared light therapy can be helpful. Red, infrared, near infrared. Vicky says, speaking of MRIs, do you have reservations about cardiac MRIs, specifically even without dye? Yeah. So I spoke about this maybe last time, a couple of weeks ago, or maybe earlier, where I related this incident where I was walking past an MRI machine, and all of a sudden I veered toward the machine like uncontrollably. It lasted for a couple of seconds, and I was like, what was that? I mean, it was like somebody had taken control of my body. It was bizarre. And it just lasted for like a split second, but I always wondered, was the MRI machine running? Was it something like it reoriented the electrons in my brain, and that somehow had an effect? Do I have heavy metals in I don't know, right? How did it affect my brain to make me, suddenly swerve for a split second? Very bizarre. I don't know. I need to speak to somebody who knows more about MRIs, but it's certainly not something that you would experience naturally, right? So if you don't, have a really good reason to do something that's so unnatural, I just wouldn't do it, because there's a limit to our own understanding of the body, right? So I bet, somebody like, what's his name? Jack Cruz, he understands more about physics and stuff. He's a neuro surgeon. I'll see if I can ask him this question. He probably has something to say about it, or can come up with some, reasoning for why it might be harmful. I just have a sense that there must be something, right? We don't know what it is. So yeah, I think we've already answered this question before. All right, let's see if there's any other questions or comments here. I'll try to go over them. But I think we'll move these to next week. There's a lot of stuff here. All right. Everyone who left a question during the live stream, we'll try to get to it next week. So Nice garden, thank you. My kids built this little place here where they do build fires, as you can see it down there. They just put a circle of stones there, and they roast marshmallows and stuff. Um, but yeah, we need to do a lot more work, right? Like we need to do something else with this place. Need to put some like Andirondack chairs over there as well. All right, so let me see if there's any other comments here. Any news on vax-induced tinnitus? 2 years and counting, sadly. Yeah, so mind-body medicine, like the lightning process or unlearnyourpain.com, is very effective for tinnitus. It, from their perspective, it seems as though your brain somehow is receiving like a scrambled signal, right? So normally we're able to screen out and make sense of the sensory inputs, right? So like babies when they're born, they can't really make sense of sensory inputs. It's just like a barrage of like light and sound, and they can't distinguish, what's actually going on and focus in on the stuff that is the signal and not the noise, right? So this, spike protein, this inflammation, it seems to like screw up the software, not so much the hardware, right? So if you think of it in those terms, it's like you need to reset the software. So you need to hit a reset button, and that is easy and possible with mind-body medicine. Obviously all the other things apply about health. It could be an issue of, needing to detox and needing to supplement certain nutrients. But if you try all that stuff and it's not working, then try mind-body medicine. So it's up to you and what order you want to go. But it is possible to fix it, and some people can even learn how to like, turn it off themselves, right? Like they focus on it and it goes away. And most people with tinnitus will have this experience where there's like days where they don't notice the tinnitus at all. And then there's other days where it's like really loud, right? So there is something related to your mind, I think, very clearly that can overcome that and just basically stop listening to those parts of the incoming sensory input that's being interpreted by your brain as tinnitus. Obviously, there's different kinds of tinnitus. Again, tinnitus is going to be caused by a lot of different things. There can be actual physical damage, but I think in the long haulers, most people don't have actually physical damage to those the cells in their ear or any part of it, right? So I don't think it's actually a physical issue, although there could be inflammation in some part, along the route from your ears to your brain. Somewhere in there could be inflammation causing issues. But I think the vast majority of people, it's more of a software issue and not a hardware issue. Yeah, AFib is a very common issue nowadays. How do you suggest to help folks with cardiac AFib? My husband got this after his vaccine. So again, it's probably multifactorial: autonomic nervous system, stress, hormones. Again, the blue light plays a big role here because it creates, you have too many stress hormones in your body, and they're not being broken down by exposure to UVA. So usually UVA light will balance the blue light in midday when you're exposed to the blue light, and it'll break down the stress hormones. So people indoors don't get any of that UVA breaking down the stress hormones. So they get exposed to a lot more of them. So they have to do a lot more to try to counterbalance them. So you can do things like infrared therapy, or you can just go outside, or you can change your windows for quartz glass, different things like that. But maybe get like a near infrared and infrared sauna, near infrared light, red light therapy, and infrared sauna, and that may help. And then other things like the thyroid can be involved. There can be and again, that's also partly due to the blue light. So it's not just stress hormones, but also hormones like the thyroid that are being upregulated. So, yeah, I mean, that might explain it for a lot of people. So, and the same thing applies. I mean, check into herbology and acupuncture and homeopathy for this as well. But it's definitely something that can be reversed. I mean, but the longer you're in AFib, the harder it is to kick yourself out of it. So you want to try to deal with it early and get yourself out of AFib so that you don't stay in it for a long time. Okay, so what helps with metal detox, graphene oxide detox? I heard glutathione, nebulizing, you mentioned chlorella. The fulvic and humic acid from Shilajit, so fulvic acid and humic acid are excellent for the metal detox and graphene oxide detox. That's so I would recommend getting Spike Buster from mygotostack.com, mygotostack.com. The Spike Buster supplement has basically everything you need for specific spike detox plus vaccine detox and heavy metal and graphene oxide detox. Yeah, so this is a good question. I think maybe we'll try to answer it next time. Which magnesium is good for brain and heart health? There's like half a dozen or a dozen forms of magnesium. And for the brain, okay, maybe we'll try to answer it this time. So magnesium threonate is the only form of magnesium that enters your brain apparently. So I would take some of that. And magnesium glycinate just for absorbing magnesium. And if you are properly absorbing the magnesium, your body can utilize it wherever it needs it. Your body can probably turn it into magnesium threonate and turn it into other forms of magnesium. But the point is that you want to get elemental magnesium into your body. So from any avenue, you can do it topically. You can put magnesium salts in your bathtub. You can spray magnesium on your skin and you'll absorb it. So it's really more important to just get elemental magnesium into your body, and then your body will utilize it as it sees fit for brain and heart health. But if you're specifically looking to inject some magnesium into your brain, it'll be magnesium threonate. And I don't think there's a specific form that you need to get it to your heart. It's just a matter of absorbing the magnesium to begin with, and a good highly absorbable form would be mag glycinate. All right, so here's another one. Actually, let's look at this one first. Titan Joe says, I'm Flox 2, found out it caused candida overgrowth. Oftentimes, like a carnivore or strict keto will help get rid of the candida overgrowth. Was a Floxy 2, it took years but recovered. Then vaccine injury, listen to the doctor, that's the way. Mitochondria, yeah, mitochondria need to be fixed. This person says, I am a wellness coach and my group is so helpful. Yeah, the coach gets benefits from the group coaching, and the group benefits, everyone benefits. It's really tremendously helpful and I think everyone needs it in the modern world because our surroundings are not optimized for our health, right? So we've designed lifestyles and designed communities and designed cities that are just inimical to human health. And so you need some counterbalancing factor, right? Some counterbalancing force that helps push you back towards, optimal environment and optimal health and good habits, right? So until hopefully we design societies and communities and architecture and, lifestyles and technology that is human friendly, right? That would be the ultimate. And I think we need to design our cities that way and design our communities that way. But until then, you need something that will help you change the habits that are hard to get in, the good habits, and get rid of the bad habits and replace them with good habits. Just because all the signals and all the things that are easy to do nowadays are bad for you, right? So it is possible to design a culture and that makes it easy to do to live healthy, but we don't have that culture. So until then, we do need things like group coaching programs where we can help each other. It's kind of like 12-step programs for alcohol and Narcotics Anonymous and all that stuff, right? So those people have such a big problem that they find themselves really in need of group help, group support. But I think everyone does. We just don't realize it, right? So all of us, almost all of us in the U.S., I mean, tremendous, probably like 60% or more of the country has at least one chronic disease. You know, a lot of obesity and prediabetes and diabetes and high blood pressure and, you know, all this stuff. So, and, you know, we've just learned to live with it. You know, it's kind of like the frog boiling very, very slowly over the course of 50 years. And, you know, it's a new normal, right? Like we've just normalized ill health, and we've normalized starting to like slow down in our 30s and 40s and 50s, right? Instead of, you know, going strong until your 70s, 80s, 90s. All right, everyone. Thank you so much for watching. Great pleasure being here with you all. Please like and subscribe, and check out all of our platforms. Check out our Rumble channel, our YouTube channel, which we rarely stream to, but we might be streaming to right now. And pro.longcovidreset.com. You can follow me on Twitter. It's at Dr. Syed Haider. On Rumble, it's at Dr. Syed Haider, all one word, DrSyedHaider. Yeah, and you know, stay safe out there. One final thing before I end. You know, I am a little bit concerned about the J.1 variant, just because Gert Vandenbosch is so concerned. He thinks this is the last variant before the killer variant, and it's just he's only concerned for the vaccinated. So I think if his warnings come to fruition, if it actually happens, what he's warning us that will happen, it would be bizarre, you know, the timing with the, you know, election year and all that. But, you know, it is what it is. I don't know. And it could be a cover for something else, right? Like a cover story for some other bioterror attack or whatever. But I think if this were to happen, because he's warning that 30 to 40% of vaccinated populations will die. The highly vaccinated populations, 30 to 40% death rates in those highly vaccinated populations. If that were to happen, there won't be meds available, right? There will be a run on ivermectin, hydroxychloroquine, everything. It'll be gone. Right, we will not have enough, and especially if we run into problems with India or China, they'll just cut off our supply because they're the ones that make the ivermectin. It wouldn't take much, you know, the way that the modern world is set up, you know, for just-in-time deliveries. People don't keep a lot of stock on hand. They just expect that they can order it as they need it, and so, you know, pharmacies, if they got overwhelmed, you could see ivermectin supplies dry up in a few days. So I think it's important. You know, there are people in my life who got vaccinated. I told them not to. And I'm telling them I think those people at this point, just on the perhaps off chance that Vandenbosch is correct, that there's going to be a severe variant developing from J.1, they should be on twice weekly ivermectin and ready to start taking ivermectin every day at like treatment doses, like 0.6 milligrams per kilogram every day, high dose vitamin C, the whole thing. If they start to see other people in their community starting to die from a new variant, they need to start treating it before they get sick, because that means that you'll be treating it when you get it, right? Otherwise you get it and then you get sick a few days later, and sometimes it's too late. So this is one concern going into the new year. You know, I'm concerned about, you know, the predictive programming from the Obamas around, you know, a cyber attack, and, you know, the people in the administration that are going on, like, you know, Fox News and whatever, and saying that, you know, we're concerned about a black swan possibly. It's like a black swan, you know, by definition is something you can't predict, and it seems like they're predicting that there will be a black swan next year. So whatever that might be, it could be multiple things at the same time. It could be cyber attack, biowarfare, you know, maybe somebody getting assassinated, you know, World War III all rolled into one. Who knows, right? So I think that this is a real crucial year, you know, 2024. I would be prepared beforehand. Get your medications on hand, get your disaster pack on hand. There's no place else that you can get it as cheaply as you can get it from mygotodoc.com. And we can prove it to you. Call the patient team, you know, at the phone number on our website, and, you know, we'll tell you this is how much the prescription fee is. This is how much the medications actually cost from the pharmacies that we have on hand. Add those two together. It's a simple thing of just adding those two things together. It's much cheaper than any other website anywhere. on the planet. Okay, it's cheaper than India, it's cheaper than the US, it's cheaper than China. There's no place that everyone else is marking up the medications. All right, they're usually selling it as one price, right? Which includes the prescription fee and the medication fee, but they're using that to hide the fact that they're marking up the medication a lot. So they're making the doctors, being paid for writing the prescription, and then they're marking up the cost of the medication, usually like double or triple. It's a significant markup, and you'll save probably at least $100 from the nearest competitor, right? So Deepak, COVID treatment, get those on hand before you need them. And I would say have some on hand for the people in your community that might be vaccinated and might need your help in case, these things dry up. All right, everyone, thanks for watching. Check out my GoToDoc and my GoToStack, and I'll catch you next time. Thanks. Bye.